I hope it will be just something that will come and disappear, but we don't know. We need time to know how the virus will, if it will keep on striking, or like rubella, once you have it, you're immune to it. So what we can tell you, we have already tested monkeys, and there's a new vaccine where they have injected in monkeys, and they have detected that these monkeys became immune to both Brazilian strain and Puerto Rican strain. This is really good. So we believe once you are immune to the virus, you have for life, but it's just something that we have detected in monkeys. We have to wait for the vaccine to be tested in humans. So I'm very fortunate to be in the capital of the state that first reported microcephaly, and now we know that it's congenital Zika syndrome. So it was back in October 2015 when we started reporting the microcephaly, and we have a rehabilitation center. So these babies were coming to our rehabilitation center, and thankfully we have all these specialists that you have mentioned. So we have neurologists, we have pediatricians, we have ophthalmologists, ENT, we have all of those specialists and therapists to assess these babies. So unfortunately, this is not the reality of my country. Many of the other states, they do not have, and these babies are losing the time of intervention, of early intervention, because we know the first year of age is such an important year for vision development, and they have not been assessed. There's no cure, so up to now we don't know of a cure. What we are doing is rehabilitating the children. So we believe in rehabilitation. We believe that a patient that is not crawling can start crawling if it has physiotherapy, if the patient is well assisted and have the support for it. So we have this amazing team. It's a multidisciplinary team that we are, every week these mothers come to the rehabilitation center where their babies are being stimulated, not only their motor system but ocular, hearing. I can tell you from the vision, so they are severely visually impaired, and we believe, like toxo, that if they have a scar in the macula, if you stimulate a patient with congenital toxo, they can choose another area of their retina as a macula and have a perifoveal fixation and then develop vision. So we believe that we can do something similar with congenital Zika infections. Up to now, we don't have information to give, to provide, and tell if it's effective or not, but since we know from other congenital diseases that this is possible, we believe in this treatment. It's at the same time overwhelming to have all this information at once, but also it's something that brings us so much, we're so attached to the families right now. So it's been 1 year where we have been seeing these families every week, and in our institution at the Altino Ventura Foundation, we have in our institution 339 babies with congenital Zika syndrome. We have become a family, and their success is our success. Every time they do something that they didn't do before, we celebrate. So it's something that has become, we did not plan for this, but the mothers, the families, we are all so engaged. So it's really nice to be working with congenital Zika syndrome. We're starting to follow the neurodevelopment of these babies, so we still do not know how will be the long-term effect of congenital Zika syndrome in these babies. What we know is that right now they're not achieving the milestones expected for their age, but we are following them and treating them, and we will be reporting this as time passes.